Good morning, everyone. Today, we will explore electrocardiography, a critical tool in cardiology. ECG is the main method for heart investigation, allowing us to analyze the heart electrical activity and rhythm. It enables early diagnosis and management of cardiac health, providing invaluable insight for both prevention. Electrocardiography involves recording the heart bioelectric potential to create an electrocardiogram. This output, commonly referred to as an ECG, gives us a graphic representation of the heart electrical pulses. By analyzing these waveforms, we can assess cardiac health, identify irregularities, and guide treatment decision. The foundation of ECG lies in its electrophysiologic principles, which include automaticity, the heart's ability to generate impulses, conductivity, or how impulses are transmitted between cells, depolarization, when positive charges activate cells, depolarization, where cells restore their charge for the next impulse, refractoriness, a brief period when cells cannot respond to stimuli, and re-entry, which describes abnormal impulse circulation. Together, these principles ensure the heart rhythmic contraction, all initiated by the sinoatrial or SA node. One of the heart's unique characteristics is automaticity, its ability to generate impulses without external stimulation. The sinus node, the heart's primary pacemaker, regulates the heartbeat at a rate of 60 to 100 BPM. This ensures the heart maintains a consistent rhythm, which is vital for proper circulation. Conductivity is the process by which electrical impulses are transmitted between heart cells. The heart features specialized pathways that allow for faster conduction compared to standard muscle cells. This system ensures that all parts of the heart contract in coordinated manner, enabling efficient pumping of blood. Depolarization occurs when positive charges flow into the cells, activating them and initiating contraction. Following this repolarization, restore the cell's original charge, resetting them for the next impulse. This cycle is essential for maintaining the heart rhythm and overall stability. To record an ECG, electrodes are placed on the body to detect potential differences generated by the heart electrical activity. The recording includes 3 standard bipolar limb reads, 3 augmented unipolar limb leads, and 6 chest leads, which together provide a comprehensive view of the heart electrical activity. The placement of ECG leads is crucial for accurate recording. Bipolar leads are placed on the right arm, left arm, and left leg. Augmented unipolar leads include AVR, AVL, and AVF, which enhance the signals. Chest leads V1 to V6 are positioned across the chest to assess different regions of the heart. An ECG waveform has several components. The P wave represents arterial depolarization. The QRS complex reflects ventricular depolarization, and it is the most prominent waveform. The T wave indicates ventricular depolarization, showing the heart recovery page. Here are the normal durations for ECG waveform. The P wave and QRS complex both last 0.06 to 0.1 second. The T wave is slightly longer at 0.12 to 0.16 seconds. The PQ interval, which represents arterial conduction time, ranges from 0.12 to 0.2 seconds. Accurate timing measurements are essential for diagnosing heart condition. Heart rate can be calculated using this formula. HR equals 60 divided by the R to R interval in seconds. A normal heart rate ranges from 60 to 100 beats per minute. Calculating the heart rate is a simple yet vital step in evaluating cardiac rhythm. A normal sinus rhythm falls between 60 to 100 beats per minute. If the heart rate exceeds 100 bpm, it is called sinus tachycardia, which can result from exercise, stress, or cardiac conditions. If the rate drops below 60 bpm, it is known as sinus bradycardia, often linked to parasympathetic activity or increased vagal tone. The electrical axis of the heart describes the overall direction of electrical activity. A normal axis falls within a specific range, while deviations, such as left axis deviation or right axis deviation, may indicate underlying cardiac issue or changes in heart position. Precise measurement of ECG wave duration and amplitudes helps identify rhythm irregularities, conduction delays, and other abnormalities. Key components to measure include the P wave, QRS complex, and T wave. ECG interpretation involves several steps. Check rhythm regularity. Identify the pacemaker site, analyze wave amplitudes, measure the heart rate, evaluate the electrical assist. Following these steps ensure a thorough assessment. Understanding the rhythm of the heart is a crucial part of ECG interpretation. A regular rhythm means that the intervals between R waves are consistent, with a variation of no more than plus minus 10%. An irregular rhythm involves noticeable variation in the RR intervals, which may indicate arrhythmias such as atrial fibrillation or premature beat. This distinction helps determine if the heart conduction system is functioning properly or if there's an abnormality requiring further investigation. Left atrial hypertrophy or P mitral is typically caused by conditions such as mitral valve stenosis or hypertension. The main ECG indicator is a prolonged P-wave duration exceeding 0.1 second. The P-wave often appears notched in regions like 2 and V1, reflecting the delayed depolarization of an enlarged left atrium. Identifying these changes can direct us to investigate underlying structure abnormalities in the left atrium. Right atrial hypertrophy, also known as P pulmonale, is often linked to chronic pulmonary disease or tricuspid valve disorders. The ECG reveals a peak P wave greater than 2.5 millimeter in amplitude, particularly in region 2, 3, and AVF. This pattern results from increased pressure and volume in the right atrium, leading to its enlargement. Recognizing this pattern helps diagnose conditions affecting the pulmonary circulation and right side of the heart. Left ventricular hypertrophy, or LVH, is associated with chronic hypertension or aortic valve disease. Under ECG, we see increased QRS voltage, often measured using criteria such as the Sokolov-Lyon or Cornell voltage. Additional findings may include ST segment depression and inverted T wave in lateral ridge. Detecting LVH is vital as it often indicates an increased workload on the left ventricle, leading to potential heart failure or arrhythmias. Right ventricular hypertrophy, or IVH, typically results from pulmonary hypertension or congenital heart disease. ECG findings include tall R waves in region V1 and V2, as well as deep S waves in V5 and V6. ST depression and T wave inversion are also common in the right precordial ridge. These changes reflect the increased pressure and workload on the right ventricle, which is important for diagnosing heart-side heart condition. Coronary heart disease encompasses conditions like angina, myocardial infarction, and coronary sclerosis. In case of ischemia, the ECG shows symmetrically inverted T waves, especially in regions reflecting the affected area. This occurs due to reduced blood flow, leading to insufficient oxygen supply to the myocardium. Early detection of ischemia patterns allows for timely intervention to prevent more severe cardiac events. Myocardial injury and infarction are critical conditions identifiable on ECG. Injury is marked by ST segment elevation, indicating acute damage to the myocardium. As the infarction progresses, we may see the development of a pathological Q wave and persistent T wave inversion. These changes occur in a specific pattern depending on the stage of the infarction and are essential for both diagnosis and monitoring. Identifying the location of a myocardial infarction is one of ECG's key strengths. For example, infarction in the anterior region appear in region V1 to V4, while posterior infarction are reflected in reciprocal changes in V1 to V3. Lateral infarction involves region 1, AVR, V5, and V6. This information helps pinpoint the affected coronary artery, guiding treatment strategies like revascularization or medication management. In conclusion, ECG remains a cornerstone of cardiac diagnostics. By understanding each principal's component and interpretation, we can effectively assess heart health, detect abnormalities, and guide treatment. Thank you for your attention.